gentlemen, allow us to move to the next panel discussion. This panel discussion will be led by Mohammed Sirdar. This panel session will focus on antimicrobial usage in animal feed. I think this is a topical discussion, and I want to hand over this discussion to Mohammed. Over to you, please.
All right, thank you. Thank you very much, Dr. Lillian, for the introductions. And I would like to say good evening or good night to some of our participants. I know that some of them are quite east, and it is almost midnight that side. So thank you very much for joining us in this session, celebrating the WAAW for 2022 Africa campaign. And for those who have not been at the beginning of the first session, I am Mohammed Sirdar. I'm a program officer at the World Organization for Animal Health, WAAW, representation for Southern Africa, based in Gaborone, Botswana. So welcome again. And in this session, we have 4 panelists. First, we have Professor Shabbir Simjee, who is the Chief Medical Officer and Global Regulatory and Technical Senior Advisor of Microbiology and Antimicrobials at Elanco Animal Health. And also we have with us Ms. Marlien de Kock, who is the Product Manager of Feed Additives at Trouw Nutrition, South Africa. And also she is the Vice Chair of the Animal Feed Manufacturers Association of South Africa, the Technical Committee, and also the convener of the Medicated Feed Committee and Animal Feed Manufacturers Association of South Africa. And also we have with us Dr. Jared Serem, who is a veterinarian working on animal health and food safety. And he's the Animal Health and Food Safety Manager in Poultry, India, Middle East, and Africa. And also we have Dr. Evelyne Nawiri, a veterinarian experienced in providing nutritional solutions to farmers. So welcome our panelists, and apologies for the delay of the start of this session. We will just go straight to our discussion. So I'll start first with Prof. Simjee. So Prof, I will just read a short biography from your side, and then that will lead us to the first question. So Prof. Simjee graduated from the University of Birmingham Medical School in England in 1992, and he specialized in infectious disease, completing an MSc in 1994 and a PhD in 1998, also from the University of Birmingham Medical School. After a brief time in research, he went to work at the US FDA between 2000 and 2003 at the Center of Veterinary Medicine, specifically looking at gene transfer between animal and human pathogens. He returned back to the UK in 2004 to take up a position at Elanco Animal Health as Global Technical and Regulatory Advisor on antibiotics. Dr. Simjee is past chair of VetPath program, a pan-European AMR monitoring program, and a past co-chair of the CLSI Veterinary Antimicrobial Susceptibility Testing Subcommittee. He has served 9 years as editor of the Journal of Antimicrobial Chemotherapy, 10 years as an editor for antimicrobial agents and chemotherapy, and continues to serve as an editor on International Journal of Antimicrobial Agents. So, Prof, from your experience and your current work at Elanco, please can you just give us more insight on your work on antimicrobial resistance and antimicrobial use, specifically in feed, and the contribution of your institution?
Yeah. Okay, great. Thank you for the invitation, Mohammed. And I did a similar panel talk yesterday in Jakarta for WAAW, and today I'm sitting in Ho Chi Minh City to do something tomorrow for you guys. So basically, I've spent almost 30 years in antibiotic research, looking at gene transfer from animals to humans, and pathogen transfer. We've spent a lot of time working with institutions like the WHO, the OIE, and the FAO, as well as a number of regulatory agencies around the world. If you'd have asked me this question probably 30 years ago, that do I feel that the use of antibiotics in veterinary medicine is a concern for antibiotic resistance in human medicine, irrespective of route of administration, so injectable, water soluble, or through medicated feed, I would have probably said that the answer is yes. And the reason was that we had very rudimentary typing methodology. So we went through a pulse field gel electrophoresis, then we did very rudimentary molecular work looking at gene typing. But as we've got whole genome sequencing advancing to the level where we can sequence whole bacteria in 2-3 days for a fraction of a cost, it's roughly costing $50-60 today. There is increasing evidence to say that the pathogens found in animals do not cross through the food chain to cause human infections, with a few exceptions, and the exceptions being Salmonella, Campylobacter, Listeria, toxigenic E. coli, Shigella. Those are the few. If we look at the whole debate of antibiotic resistance on the human side, it's predominantly in the hospital setting. It's not even in the community. And within the hospital setting, it is pathogens like Klebsiella, Pseudomonas, Acinetobacter, VREs, MRSAs, which are all hospital-borne infections. So we need to understand that the root cause of infections on the human side are primarily in the hospital setting, and primarily because of the setting that those pathogens are living in. Now, someone earlier referred to the O'Neill report and said 50 million deaths, or I can't remember the number, by 2050. That report was highly overstated, and O'Neill himself. So what happened was the British government gave O'Neill the task of chairing this AMR task force. When his final report was completed, they basically kicked him out of that task force and he left government. He then did a number of interviews where he admitted he knew nothing about AMR. And he also admitted that that number that was cited in that report for 2050 was based on the fact that they took the number of infectious diseases in the world, and then they said every one of those infectious diseases would be a septicemia that was multi-drug resistant. Now, we know that not every infection in humans is going to be septicemia, and we know that every infection is not going to be drug resistant. So that number that was quoted in the final O'Neill report is actually a fictitious number. It's not even a real number, and it's there to scare people. Okay. Now, I'm not saying we don't have a problem in veterinary medicine. So if you look at your disease-causing organisms in veterinary medicine, so let's say Pasteurella in chickens, Mannheimia in cattle, E. coli, and so on, we do see an upward trend in resistance. However, the level of resistance we're seeing in veterinary medicine is probably 10 to 15 years behind what we see on the human side. And if we don't use antibiotics responsibly today, and given the fact there's no new antibiotics in the pipeline, we're definitely not getting a new class of antibiotic in veterinary medicine for at least another decade, if not longer. We will not have any antibiotics left in 10, 15 years in veterinary medicine. So I'm not saying that, we're not contributing to humans means we can abuse antibiotics. We cannot. Now, having said that, medicated feed is the easiest route of administration for animals. You've got chickens, 50, 10,000, 20,000 in a house. You cannot inject every single one. So the only way of medication is water or through medicated feed. But that's also the route of administration that's probably most abused, partly because as the world has transitioned from moving away from AGPs, growth promotion use of antibiotics, veterinarians, farmers are starting to rely more on the prevention label claim through medicated feed, almost as a substitute for AGP. It's also a substitute for bad animal husbandry. And, there's a big drive to say, unless you're careful with medicated feeds, you're going to risk losing certain claims. And that's what Europe has done. Europe allows prevention through injection in water soluble, but not through medicated feed.
Yeah, no, we'll come to that. So I just want to pause here because I think that's a very good point that we will go to in the discussion regarding the growth promoters and the European experience. So if you allow me to go to our second panelist, I would like to welcome Ms. Marlien de Kock. As I mentioned earlier, she's currently the Feed Additive Product Manager for Trouw Nutrition South Africa and has followed a 25-year career in animal pharmaceutical industry prior to changing her direction to feed additives and working towards strategies to combat antimicrobial resistance in the intensive animal production market. And Marlien obtained her BSc and honors and degree from University of Pretoria and started her career at Elanco Animal Health as well. And following 10 years at Elanco, she joined Lerem, where they first encountered phytogenetics in intensive animal production. Marlien, now in this panel, she's representing the South African Animal Feed Manufacturers Association. So she has been involved with AFMA South Africa for more than 10 years and currently serves as the vice chair for the technical committee and chair of the Medicated Feed Subcommittee, as well as a member of various other AFMA committees. So, Mr. de Kock, please, can you, you have a very interesting CV, and also we think that the South African Animal Feed Manufacturers Association is doing a lot in this field to combat antimicrobial resistance. So please, can you just give us a background of AFMA on combating AMR and their role in general, just as an introductory, so that the audience can know more about AFMA. Thank you.
Thank you very much, Mohammed. Yes, AFMA is the industry representative body of the South African feed industry. And the vision for AFMA is to be a dynamic animal feed thought leader and influencing food security through partnerships and stakeholders. So AFMA has an extremely long history. They were formed in 1945, and since then AFMA has been actively striving towards realization of its vision, and mainly through liaising and collaborating with various government departments, work really well together with government, regulatory decision makers, parastatals, agricultural forums, and on international part of IFIF and other related role players, and as well as together with other industry bodies in South Africa itself. And AFMA mainly influences factors which is bearing on agricultural output and productivity. So we focus on feed manufacturing, but also what comes before feed manufacturing and sometimes what goes beyond that. And that's where the medicated feed also comes into. And we strive to creating awareness among our industry role players of any threats and opportunities facing the industry, and formulating unified action plans accordingly. And we have a code of conduct towards which our members use as a self-regulation, but it's also audited. And there we follow 12 areas where we look at mainly legal parameters that we need to keep to, and one of those things specifically is how we use medication in feed. So those things are really well audited and followed up by our members. And our members in the industry, we have almost, well, I'm not sure percentage-wise, but of all the big feed manufacturers, mainly most of the feed manufacturers are members of AFMA. We consist of 155 members, of which 63 are manufacturers of compound feeds. So we also have premix companies as well as input suppliers that are all members of AFMA. And we really strive to working together with government and everyone to make sure that we have safe feed for safe food.
Oh, that's great. No, thank you very much for this introduction and the great role that AFMA is playing. So I will move to our third panelist, Dr. Jared Serem. He's a veterinarian, he's a DVM and also a PhD. I understood the PhD is also on feed and nutrition, and also animal health and food safety manager in poultry, and covering the area of India, Middle East, Africa. And welcome, Doctor. And I would like just to, if you can give us just a brief background on your company and your role with antimicrobial use.
Yeah. So thank you very much. I think this is a very well balanced panel. So I work for Diamond V, which is a company of Cargill. It's a global company. It's headquartered in the US. It was established quite a while back in 1943. And the main role or what the company does is it manufactures additives or nutritional health additives, natural nutritional health additives that are used to support the immunity and gut health of animals, so that we can be able to help them perform better. So basically that is what we do. And the other thing that we do also is we have technical experts such as I. So we do support producers, and we also do support feed manufacturers on how to produce safe feed and also healthy animals, so that we can be able to preserve the antibiotics. That I think that is the main point, that the aim or what we're trying to do is not to really eliminate or substitute the antibiotics, because nothing can be able to substitute, but rather trying to be able to minimize and be able to preserve what we have, so that we can be able to use them even over and over again. Thank you.
Great, thank you very much. Yeah, I agree with you. The prudent use of antimicrobial, that's our collective aim. Thank you. I will move to Dr. Evelyne Nawiri. Dr. Evelyne is a veterinarian experienced in providing nutritional solutions to farmers, promoting use of probiotics, prebiotics, phytobiotics, and organic acids, while promoting good farm management practices to prevent diseases and reduce antimicrobial use in livestock. Dr. Nawiri, please can you just take us through about your experience with farmers and other livestock keepers on the best management practices that are contributing positively to the reduce of antimicrobial use?
Okay, it's good that I joined this panel discussion. I've been in this industry since 2008, and what really spurred me to move into this industry is that there was rampant use of antimicrobials in poultry feed and even in drinking water. And the key driver was because of it was easy for the farmers to control diseases through use of antimicrobials, because they could see results immediately. And even there was a lot of campaign on use of antimicrobials in poultry from in day-old chicks for the first week of life. So it became a big issue in this country, and I thought we must have a way against it. So that's why we started our company to campaign against this. And after evaluating use of antimicrobials in feed and in water, we realized that it does not really add value, because farmers had already gotten used to using antimicrobials without even appearance of disease in the farm. So it was the norm. So after introducing use of other alternatives in feed and
إذا وضعنا بعض الإجراءات.
After introducing use of other possible
استعمال بعض العوامل.
Somebody's talking from the behind. So we realized.
Sorry for that. We just muted there. Yeah.
Okay.
Please.
So when farmers tried options of using other products in feed and in water, they realized that they were making more profits. They were having uniform growth in their flocks. And actually, they reduced the economics of scale. The economics of scale and their profitability was good. So then, in the second question, you were asked why then do farmers use these antibiotics in feed? The reason
Yeah,
is
maybe you can pause here if you don't mind. Yeah, so that before we go to the second question, so we could have another round of questions and then we'll come to the second question. But thanks for highlighting your role and trying to help the farmers with using other alternatives rather than using antibiotics. I will go back to Prof. Simjee. Prof, I think there are new regulations now in the European Union to try to contain or limit the use of antimicrobials in feed. And I think you have a role as part of that whole process that led to these new regulations. So what do you think we can learn from the European Union experience, actually, just to have a brief about what are the regulations? Are they banning everything? Is it just limiting some things? Is it just growth promoters, or what actually these regulations are? And how can we replicate that in Africa? Is it visible that we can do that here within our continent?
I'll address the AGP question first. So the growth promotion use of antibiotics in Europe was based on the precautionary principle. And at the end of 2006, AGP use for antimicrobial or antibiotics was banned in the European Union. That ban came into effect on the 1st of January 2007. And one of the unintended consequences that we saw of the ban, and we still see, is that disease incidences increased a lot across the whole European Union, and therapeutic use of antibiotics increased. So therapeutic use means for disease treatment and control and for disease prevention. The US took a more pragmatic approach, and the US did a whole risk assessment process with respect to the use of AGPs. And the US made the decision, which came into effect at the end of 2016. And the decision made by the US was aligned with the decision from the WHO, which was that basically medically important antibiotics could not be used for AGP purposes, but non-medically important antibiotics can be used for AGP purposes. And that was based on the WHO's critically important antimicrobial list. So in 2017, the WHO published a document titled The Use of Medically Important Antimicrobials in Food Producing Animals. And they clearly, they had a series of recommendations in that document. And one of the recommendations was globally to phase out medically important antibiotics for AGP use. And that's what the US did. And I think for most countries, that's probably a very logical approach and stance to take. We understand, we're not 100% sure how AGPs work, but one thing we know is that it does positively modulate the gut flora, and it does allow the gut flora to behave in such a way that it's harder for pathogens to take seed. Okay, and we do see that animals on AGPs tend to have less illness. So I think for most countries, that's a very practical approach to take with respect to AGPs. Now I'm sitting in Asia at the moment, and that's what most of the Asian countries have done. That's what most of the Latin American countries are doing. And that's moving away from medically important antibiotics. Great. With respect to post that, what we've done in Europe, we have two regulations now. One's the medicated feed regulation, which is probably more relevant to this discussion. And then we have the veterinary medicines regulation. The medicated feed regulation stipulates that you can only use antibiotics in medicated feed for disease treatment and disease control, not for disease prevention. And note the words very, very clear here. It's antibiotics, not antimicrobials, because ionophores are classed as antimicrobials because they're antiparasitics. We have antifungals, antivirals, antibiotics, antiparasitics, or antiprotozoal. So in Europe, at the start of January, on the 28th of January this year, those regulations came into play, and antibiotics can only be used for treatment and control through medicated feed. They cannot be used for disease prevention. But ionophores are antimicrobials, and they can be used in medicated feed for disease prevention. The veterinary medicines regulation says if the route of administration is an injectable or water soluble, you can then use antibiotics for treatment control and for disease prevention. However, for prevention, it's for single animals or small groups of animals. So that's where we sit now in Europe in terms of those regulations and how they want to control the spread of antibiotic resistance.
Okay, this is very interesting, and I will just go back to your point where you mentioned the AGPs. Okay, what has been done in the US? Okay, following a risk assessment approach, and then okay, while in Europe it was like kind of a ban. So this will lead me to a question straight to AFMA, to Ms. Marlien. So now we had a picture about the Europe, other continents approaches. So in South Africa, is legislation in the South African animal industry changing relating to the use of in-feed AGPs in effort to reduce antimicrobial use? So are you kind of replicating what has been done in the US or in the European Union, or you have done your own assessment here within South Africa?
So there's been a lot of work done in changing legislation. South Africa is still one of the countries in the world, and in Africa we tend to have a little bit more use of AGPs, but we still allow it. But there has been a change, and one of the biggest moves is towards really changing the use of antimicrobials to have more veterinary oversight. So our laws have been a little bit split in that instance. So we have veterinary medicines, and then we have stock remedies. So stock remedies really didn't need prescriptions, and all the AGPs fell under stock remedies. So there's some move to change that if it is going to be more towards a European view of absolutely no AGPs versus the US of just the critical importance. That I think is still up for debate, but that we are moving into a direction that there should be a lot more veterinary oversight is important, and that's something that AFMA supports. We support alternatives, and we support prudent use of antimicrobials.
Thank you very much for that response, and we are looking forward, because we believe that South Africa is always a role model for other countries within the sub-region and within the whole continent. So we are looking forward to your experience and trying to share that within our region. Dr. Jared,
yes,
I understand your company is based in the US, but you are working for the 3 or 4 regions. Is it based in Kenya?
Yes, based in Nairobi, Kenya.
In Nairobi. Okay.
Yeah.
So
Yes.
I would like, just following the 2 previous interventions by the panelists. Okay, are there any your company, is it are you assisting in any way in trying to inform policy or regulations in Kenya, or your approach is just like your company is just trying to lead the way through prudent use of antimicrobial? Is there any kind of work together with the regulators?
Yes, so there's no direct work with the regulators, but one thing that I would like to highlight is we have, like for instance, in poultry production, we have these integrators. So in as much as we are talking about the antibiotic like ban, there are people who are already ahead, especially the producers, the integrators and feed manufacturers. So there are quite a number of them who have already moved a step ahead to try and minimize or not. And basically it's because of the consumers. So a lot of these producers or the integrators, the producers of the broilers, they are listening to the consumers. Consumers are more aware and they want some antibiotic free. So if you walk to the supermarkets, you will see a lot of no antibiotics ever, or these birds were produced without antibiotics. So what I can say is in our solutions that help those people who are already not only those who are already moving towards the non-antimicrobial or non-AGP, but also those who are still using AGPs but are planning to reduce, because we know that we cannot be able to eliminate AGPs, because in Africa and in some of the regions that I've worked in, we have quite significant challenges, starting from the environment, the raw materials quality is very poor. So all these challenges actually are really prompting the producers to be able to use a lot of AGP. So in our company, yes, we don't really work directly with the governments, but rather, sorry, you can hear me?
Yes, we can hear you. Yes.
Okay.
There was a
so,
little bit of a lag, but now you can hear you well.
Okay, thank you. So yeah, so what I was trying to say is we don't work directly with the government, but we're trying to help and support where we can be able to support, so that the producers can be able to slowly and gradually produce their animals in a healthy way without necessarily having to use excessive antibiotics in feed, but rather prudent. Thank you.
No, thank you very much, Dr. Serem. Dr. Nawiri, I'm really inspired by your contribution on promoting the use of alternatives to antibiotics in feed. And you mentioned that you had to change the whole perception of farmers and try to take them from one point where they had to use antibiotics because it was the only solution, okay, to try and make that, okay, something that they had to think about, okay, economically. So can you give us just some details on how you succeeded in taking them from one step to the other?
I think the first, we had an analysis of various farmers, and then we did a field trial on use of probiotic versus antibiotics in broiler farms. So after the trials, the farmers on antibiotics had used a lot of money on antibiotics from the beginning of the trial to the end, when the birds were ready, and the farmers on probiotic used less in terms of money to buy probiotics and raise broilers on them. And uniformity was good, weight gain was good. So from that, the results of that field trial, farmers were convinced that they can do away with antibiotics. So from that, then we started working on locally with the veterinary officers in the local areas where we are based in trainings. So during the trainings, we'll have farmers who had the experience, who went through the trial, to talk to other farmers. And so many farmers have adopted, and with the help of World Animal Protection in campaign against antimicrobials, many farmers have adopted, and they are now very sure that whatever food they are going to eat, even outside their localities, they're eating safe food. So that has really helped.
Thank you very much. I think this type of experience can be shared widely and can be replicated in other countries within the region. I'm sure, okay, what you have done, it's something, it's a success story that we can try to amplify and try to, yeah, you can help other sectors and other countries to move forward with that. Prof, I would like to, we don't want to get into a debate, but is it possible that your views, you mentioned that in the introduction briefly, but just we want, it's not also an answer, but AMR in animal health driving resistance or use of antimicrobials antimicrobial use in animal health is the main driver of resistance, or is it the use in human health that's what's contributing more? It's a debatable question, I know, but maybe we can just have some of your views on that.
So I'm not saying we do not have resistance in animal pathogens. We are slowly seeing an upward creep, and that is obviously being driven by non-prudent use of antibiotics in veterinary medicine. Okay, but the whole debate about is antibiotic resistance from animals causing or compromising antibiotic use in humans, there's more, excuse me, there's more and more data suggesting that's not the case. And I'll use a very quick study that was done by the Danes back in 2000 that led to the whole concept of host adaptability. So the whole concept behind this was that we always said Enterococcus is an Enterococcus is an Enterococcus. And that's true when you see it from humans. So you get an Enterococcus faecium from a child, a young adult, and an elder person, you will get a very tight-knit clone of Enterococcus. So, you know, everyone talks about variants in COVID, right? So similarly, you get variants. And we'd use the word clones, but let's say variant 1, 2, 3, 4, and 5 are found in humans. So what the Danes did was that they got some students, they cultured their feces for vancomycin-resistant Enterococcus. They selected those students that were VRE negative, and they gave them VRE from poultry. So vancomycin-resistant Enterococcus from poultry. And by day 5, the first student was VRE negative. By day 14, all the students were negative. They then gave them VREs from pigs. They saw the same thing. They then gave pig VREs to chickens and chicken VREs to pigs, and they saw the same thing. But when they gave pig VREs to pigs and chicken VREs to chickens, those VREs colonized indefinitely. That led to the whole concept of host adaptability. And what we see today is, besides a few infections, so Salmonella, Campylobacter, and some of the foodborne, animal bacteria do not colonize humans and cause infections. There's a whole wealth of whole genome sequencing data now that is supporting that idea. Also, when we start talking about gene transfer from animals to humans, bacteria, that's not happening either, because we've got the whole area of plasmid incompatibility groups. And we are seeing more and more animal plasmids are not compatible in clones, bacterial clones within humans. So I think we need to get away from this notion that is antibiotic use in animals driving resistance in humans. More importantly, in Europe, in some European countries, we've reduced antibiotic use by over 50%. The UK, Germany, France, on a voluntary basis. It's not just this year, we've done it over the last 4 or 5 years. Antibiotic use in veterinary medicine continues to go down in Europe. Resistance in humans continues to increase. There is no correlation with, you know, if you think that, and the best example I can give you is Dame Sally. She was the chief medical officer in the UK. She's very vocal in the tripartite. You will hear her all the time. She has publicly said that antibiotic use in veterinary medicine is not responsible for driving resistance in humans. The resistance we see in humans is because of human use of antibiotics. And she hasn't just vocally said it, she has published that in the VMD's annual report. And I'm very happy to, you know, send you guys that report to see. But even Dame Sally, who's been a big proponent of AMR on the human side, admits human resistance is not being driven by veterinary use.
Thank you very much, Prof.
So hopefully that kind of adds a bit of context.
Yeah, no, it definitely adds. Yeah, and at the same time, I also agree with the other point of view where that, okay, there is a lot of misuse, okay, in the veterinary side. Also, we need to watch that space, and we need to work hard also in the veterinary side so that, okay, we don't have other problems. And I have seen a comment that has just been posted by Mabel Awoth from Nigeria of the use of antimicrobials in animal health is one of the drivers of antimicrobial resistance. we can't say, but it's one of them, especially when used as growth promoters and without veterinary supervision. In some settings in Africa, antimicrobials are already available without prescription by the vet. So this encourages abuse and misuse of these antimicrobial, hence driving resistance. We agree with that. Yeah, we have a lot of problems here in Africa, and coming to those kind of practices.
Mohammed, can I just quickly add
Yes.
to that? That was exactly the same discussion we had yesterday in Jakarta in this type of meeting. It was about veterinary oversight. And one of the discussions was most countries do not have enough veterinarians. That's the problem, right? So we accept that you need veterinary oversight and you need prescriptions. But if you don't have enough veterinarians, how do you manage that whole veterinary oversight?
Yes, and that's one of our biggest problems here in Africa, that we don't have enough veterinarians, and where we have enough veterinarians, or mostly enough, that they are all clustered in urban areas or clustered in cities. So we have some lack of veterinarians in rural areas. So thanks, Prof, for that. I would like to, in 1 minute, by the way, before I go to the second question, please post any questions you have in the chat. We will have around 10 minutes of discussion. So please post your question to any of the panelists if you have any questions to be asked. So I would like to ask Ms. de Kock, in 1 minute, if you can tell us, is the Southern African, talking about the whole Southern African feed industry, ready to operate in an environment without in-feed AGPs?
Thank you, Mohammed. Yes, this is a topic I'm quite passionate about, and I believe that here we are going to have to look at the evolution of the animal scientist or the nutritionist, really, that focuses on animal feed. And we've had a few speakers that have spoken about it, and that we need to make sure that we have healthy animals, a healthy gut, healthy animals. We use antimicrobials because animals are sick, or we know they are going to get sick. So we know that there is so many different research going on regarding different feed additives, organic acids, probiotics, prebiotics, but also on a nutritional side, that we're not just formulating diets anymore for NIR standards or for NRC standards, but that we have to look at a deeper physiology. We have to look at the immune system and so forth, and there is a lot of solutions. It is just making sure that it is financially viable for the farmer. That is the important part.
Okay, thank you very much, Doctor. So before we move to another panelist, what would be your recommendation for the participants, or for the farmers, or for the industry? Just a one sentence recommendation.
Closer working together are veterinarians and animal nutritionists, as we have to conquer that gap that we have between nutrition and animal medicine, because we're going to move into an area of feed additives that is basically unknown for both these parties. And I absolutely love the idea that our other panelists, that she has really, as a veterinarian, taken on feed additives and alternative methods of looking at animal health. And it's working together, and it's just trying, we have to focus on the aquaculture side. They also mentioned that there's important things. We have to look at management, biosecurity. There's so many things. We've always used for many years antimicrobials to cover up things that we've been lacking on biosecurity and management as well, and nutrition.
Thank you very much for that. Dr. Serem, sorry if I pronounce your name wrong.
That's correct.
Yeah. Thank you.
Yeah.
So also I want to replicate the same question. What would be your recommendation to farmers, to manufacturers, to the industry you work with in Kenya, and what could be the contribution of your company to lay those recommendations on ground?
Yes. Yeah, so thank you very much. That's a very good question. Actually, I was looking forward to it. So I think to the feed manufacturers, other panelists have spoke about it, but we have different levels of the diet. So we have the formulation of the diet. So we have to move towards precise or precision nutrition, where you formulate just exactly what the animal needs, and you don't leave something else that the microbes or pathogens are going to use. So that's number one. Number two is on the sourcing of the raw materials. That's a very key point because of the contamination and so forth. And then the other point that I would like to mention also on the feed manufacturers also is there is a whole lot of science in feed manufacturing. So a lot of our small millers, the large millers, they have the capacity, but the smaller millers, they don't have the capacity to be able to produce a quality feed, that, if I can say, in terms of the presentation, in terms of pelleting and so forth. And then, of course, I would encourage them to use additives. And to the farms, biosecurity comes number one. They have to make sure that they have a good management practice, the housing. We also have to make sure that they have good, they vaccinate their birds and or their animals. And then the other thing also about the farms is they have to make sure that they keep up and they get, they use the new information that they get so that they don't just get stuck. So basically that will be my advice at this moment. Thank you.
Thank you very much, Dr. Serem.
Yeah.
Dr. Nawiri, yeah, the same question on your recommendations to the whole value chain that you work with.
So to the feed millers, my advice would be to do proper planning, because at large scale level and medium scale level, they are able to plan to source materials well, but small scale level are not able to plan well because of financial capabilities. So at the small scale level, that's where we have many issues of antimicrobial usage to prevent diseases. So source of the raw materials is very key in this level at feed millers level, and then the other way is to encourage them to adopt use of probiotics in feed formulation instead of relying on old methods of antimicrobial usage. And then at farmer level, we recommend that biosecurity must be key in their management, in their system. So they must embrace proper biosecurity measures. Secondly, proper management systems to reduce disease burdens and improve on productivity. And thirdly, to embrace use of probiotics in water to reduce effect of disease-causing agents to their animals. So that's my parting shot.
Thank you very much for those recommendations. Thanks a lot. Prof. Simjee, also I'll give you a minute to give any recommendations from your side.
Yeah, sure. One thing I would say is that please don't follow what we've done in Europe or in any other countries. Africa is a region on its own. Your climate is different. Your animal raising practices are different. You know, you've got so many other different factors that are different from Europe, US. The best thing you can do is formulate responsible guidelines, responsible use guidelines, one at a national level, and then more importantly, break it down to sector levels. And each sector, poultry, swine, cattle, aquaculture, develop their own responsible use guidelines. There's a lot of good templates out there. The US Food and Drug Administration has done this already. I think this is exactly the direction you guys need to be taking.
Thank you very much, Prof. And also I'll just add that for all participants, you can also visit our website, WAAW develops standards and guidelines and codes for the whole range of in animal health, animal welfare, and veterinary public health. So www.WAAW.org, and you can find in the tab of publications all of and manuals, codes, all of what you need. I think we are just 4 minutes before the end of our session, and there are some comments. It seemed that the session was so good that people are not asking questions. They're like satisfied, but so there's only comments. So I see a comment regarding what we have touched on earlier from Mabel Awoth from Nigeria. To deal with the issue of insufficient number of veterinarians, it is important to train more paravets or animal health workers or community animal health workers to support the available veterinarians in the rural communities. Fully agree with that. And we had a big experience with the eradication of rinderpest, where, okay, the paraveterinarians and animal health workers and community animal health workers, they had a big role to play in the eradication of the disease. There is also a comment from Ismail Akani from FAO saying, thanks, Prof, for the statement over misuse of antimicrobials in veterinary medicine is not the main driver of antibiotic resistance. This will allow to better target awareness campaign in responsible and prudent use of antimicrobials in veterinary medicine. And also, Dr. Nelly Isiagi from AU-IBA, another thing is to have standards for feed ingredients. This will also encourage producers of ingredients to handle their produce appropriately for animal feeds. Yes, definitely agree with that. Then there is Faisali Poswal. Can you tell the name of report submitted about livestock not affecting human-animal resistance? I think this is directed to Prof. Simjee. So, Prof, yeah, if you can share with us the report, and then we send it to all participants who were with us today.
Yeah, I will dig it out. It's the VMD report, the Veterinary Medicines Directorate in the UK, and it's a few years back. So I will find the report and I will share it with you, Mohammed, and then you can share it with the group.
Thank you very much. We really appreciate that. I would like to thank all our expert panelists for this insightful discussion. Thank you very much, Prof. Simjee. Thank you, Ms. de Kock. Thank you, Dr. Serem, and thank you, Dr. Nawiri. We learned a lot, and we really hope that all these recommendations and what we learned from here, we'll put it into practice. Thank you very much, and I will hand back to Dr. Lilian Wambua.
Thank you very much for that really informative panel discussion around antimicrobial use in feeds. Before I close the session, I really would like to ask my own question to the panelists, and this question is directed to Professor Shabbir and or Marlien, or both. The use of I like the way you describe the use of the ban of the different antimicrobials as growth promoters, use of antimicrobials as growth promoters in feed in Europe, and you referred back to the American case where instead of banning everything, they banned the use of antimicrobials that are used in human medicine. Now, both WHO and OIE have a list of critical antimicrobials, in fact, antibiotics that are used in human by WHO and in animals by WAAW. And so I want you to maybe just give us your views about the use of colistin, which is a critical antibiotic, for treatment of complicated bacterial infections, both in animals and humans, but it's rampantly improved. Sorry about that. It's rampant use, uncontrolled use in most African countries. What is your take on that?
Well, I think, firstly, what China did and what most of Asia did was to very quickly ban the use of colistin. I think that wasn't appropriate, because although we only found the resistance gene recently, there's been studies gone back to historical collections, and the MCR1 gene has been around, as far as we know, as far back as 1981, 82. So it's been around for 30, 40 years. It's not compromised colistin use in humans. Secondly, if you really look at it, colistin isn't that often used in humans. It's quite toxic, so it's very rarely used. And Europe has the most draconian laws on antibiotics, yet we haven't banned colistin. The European Commission did a full risk assessment, and what they decided was to reduce the volume of colistin usage to a target of 5 milligrams, but we haven't banned it, which shows that even Europe doesn't think there's a risk of using colistin in animals that compromises human use. So that, from that perspective, I think taking drastic actions against colistin is inappropriate, but there needs to be active efforts to reduce the use of colistin, if that helps.
Thank you. I think the colistin debate can go on for a long time, but I really again echo colleagues. Thank you so much. It's been an excellent panel discussion, of engaging and well appreciated panel discussion. You can see from the comments. We wish to panel discussions to a close. We would like to appreciate all the panelists that have taken their time out of the busy schedules to be part in its various forms. And so we also learned from this last panel discussion the critical importance of public-private partnerships, as well as the value of research in, we've heard about the field trials that were conducted, we've heard about the risk assessments and their importance, the surveys, the value of research in driving or anchoring our policies around AMR and AMU. We also are called upon to really strengthen our regulatory framework around the use of antimicrobials in feed, and to disseminate knowledge of very well validated approaches or use of antibiotic alternatives. And so with that, ladies and gentlemen, thank you so much to all our participants. Thank you also to our interpreters who have joined us and helped us to follow these panel discussions, these two panel discussions. I hope you have enjoyed as much as I have enjoyed the two panel discussions. And apart from enjoying, that you have learned something, and that we are going to use everything we can to fight the scourge of antimicrobial resistance. Thank you very much, and good day, good afternoon. But before we go, ladies and gentlemen, we would like to take a photo. We would like to take a photo. And at this point, we invite you all, before you quickly log out, to switch on your cameras so that we can take a photo. Lynn will tell us when she's ready. Please let us all switch on our cameras. Never mind your background. It's fine. It's okay. Please switch on your cameras. Lynn, you will let us know if you've taken the shot. Yes, and if everybody has their camera. Over to you, Lynn, and after this, we close.
Okay, thank you, everyone. I have my shots. So, good day. Good evening.
Good day.
Thank
Good
you.
day,
Bye.
everyone.
Thank you,
Bye.
everyone. Bye.
Bye.
Thank you.
Thank
Bye-bye.
you. Bye-bye.
Bye.
Bye.
Glory to God.